Dogs rely on licking for essential biological functions: grooming, tasting food, and expressing social bonds when greeting a packmate. This baseline makes it difficult to interpret the behavior when a dog begins repetitively licking inanimate objects, drywall, furniture, or bare floorboards. Clinicians define this specific, out-of-context repetition as excessive licking of surfaces, or ELS. ELS creates a diagnostic dilemma that often leaves pet owners and veterinarians looking for a clear root cause. While social licking has an established communicative purpose, ELS forces clinicians to distinguish between a neurological compulsion and a hidden physical symptom. Historical veterinary literature predominantly classifies this behavior as a primary central nervous system disturbance. These dogs typically receive psychiatric labels, such as canine compulsive disorder, assuming generalized anxiety or conflict. The standard treatment regimen follows this psychological model, relying on behavioral modification therapy and medications like selective serotonin reuptake inhibitors. Applying these treatments assumes the problem originates in the mind, an assumption that fails to resolve the behavior in many cases. Emerging evidence suggests that ELS may instead serve as a nonspecific behavioral indicator of underlying gastrointestinal pathology. Defaulting to an anxiety diagnosis carries the risk of overlooking a physical disease. This possibility necessitates a critical reevaluation of the diagnostic process. To test the gastrointestinal hypothesis, researchers at the University of Montreal conducted a prospective clinical study designed to isolate physical variables. This peer-reviewed data was published in the Journal of Veterinary Behavior. The involvement of Elsevier underscores the rigorous academic nature of the study's data collection and review process. The researchers used a cohort of 19 dogs presenting with ELS and compared them against a control group of 10 healthy dogs. Any dogs already receiving gastrointestinal or ELS medications were removed to ensure a clean biological baseline. Both groups underwent exhaustive internal medicine workups, including upper GI endoscopies and mucosal biopsies. This approach bypassed subjective behavioral surveys to provide a direct look at the biological reality of these patients. The findings were stark. 74% of the ELS dogs had identified gastrointestinal abnormalities, while only 30% of the control group showed even mild findings. Most of these issues were proximal GI disorders, specifically localized to the stomach and the duodenum. Biopsies revealed infiltrative inflammatory conditions, including 5 cases of eosinophilic infiltration and 3 of lymphoplasmacytic infiltration. Researchers also identified 7 cases of delayed gastric emptying, a significant functional disorder. The remaining diagnoses in the cohort included irritable bowel syndrome, chronic pancreatitis, and giardiasis. Crucially, 9 of the 19 ELS dogs, nearly half the group, showed no clinical signs of GI distress. They experienced no vomiting and no diarrhea. This data indicates that ELS can be the sole visible symptom of a severe gastrointestinal disease, even in the absence of traditional digestive signs. Researchers transitioned from diagnosis to customized gastrointestinal treatments based on the specific endoscopic findings. Infiltrative disorders were managed with elimination diets and steroid therapies. Functional issues, such as delayed emptying, were addressed with prokinetic drugs and targeted antacids. The dogs were observed over a 90-day monitoring period to track their response to treatment. 59% shown a significant reduction in licking frequency and duration. In 53%, the behavior completely resolved. The resolution of a presumed psychiatric compulsion through the use of antacids and prokinetics demonstrates that the root cause was physiological. One might ask if these dogs simply suffered from concurrent anxiety-driven OCE alongside their stomach issues. To address this, researchers conducted a behavioral video analysis of both groups in a stressful veterinary environment. They measured specific markers of stress, including postures, respiratory rates, locomotion, and vocalization. This radar chart shows the anxiety markers for both groups. The results are nearly identical, with the ELS dogs showing no significant difference in anxiety compared to the healthy control group. This finding officially uncouples surface licking from generalized anxiety, challenging the assumed link between ELS and canine compulsive disorder. What is the biological mechanism that connects a gastrointestinal disorder to the act of licking a floor? Gastric mucosal inflammation, or a failure of the stomach to empty properly, triggers persistent nausea. Excessive licking and swallowing are hardwired physiological responses to that nausea, intended to stimulate salivation and protect the esophagus. This licking represents a physical reaction to gut pain. The dog attempts to soothe a burning or nauseous gastrointestinal tract through salivation and the associated reflex. These findings shift the clinical priority for modern veterinary practice. Presenting cases of isolated ELS should not lead to an immediate prescription of SSRIs or behavioral modification. The protocol requires an exhaustive internal medicine evaluation, focusing specifically on the proximal GI tract. Do not wait for vomiting or diarrhea. ELS may be the only visible indicator of severe infiltrative disease or delayed gastric emptying. Clinicians should investigate the gut before diagnosing the brain. In over half of ELS cases, treating the stomach resolves the compulsion entirely.